Welcome back to yet another episode of Health Unplugged as Superstars, where we bring medical experts into conversation to help us about the life changing diseases. Today, we are talking about something incredibly precious, yet something that most of us take for granted our vision. Most eye diseases give us few warning signs like blurred vision, irritation, redness, or even discomfort. But imagine a disease that quietly steals your vision without pain, without even a simple symptom, and without even realizing that it is causing a permanent damage to your eye. That's exactly why glaucoma is often called as the silent thief of sight. The worrying part is that many people don't lose their vision because of medical treatment doesn't exist, but because they have delayed their treatment or they have simply discovered the disease too late in the stage. So today we are going beyond glaucoma itself. Joining us today is Dr. Digvijay Singh, who is a director of Noble Eye Care Gurgaon. He is a glaucoma specialist and a pediatric ophthalmologist from AIMS, New Delhi. He is the past president of Young Eye Doctors Society of India and secretary of Gurgaon Eye Doctors Society. So thank you for your presence on this podcast, doctor. So let's start talking on glaucoma.
So it's a pleasure to be here and I look forward to our discussion.
Yes, sir. Let's get started. Welcome back to yet another episode of Health Unplugged as Superstars, where we bring together the experienced medical experts to answer the questions that matter the most. But so let's start with the first segment. So, Dr. Digvijay, why does glaucoma is described as the silent thief of sight?
So glaucoma is a disease which does not have any symptoms
Okay.
to begin with. So for most time, the patient will not realize that they have the disease.
Mhm.
It is presenting with loss of vision in the periphery, which
Okay.
keeps on shrinking and shrinking. So as your visual field keeps coming down, you don't realize it till it reaches your actual day-to-day vision. And by then it's too late. You
Okay.
can't quite reverse it. So hence it's called the silent thief of sight.
Okay. So, doctor, isn't that surprising that glaucoma can actually, damage the vision over a period of time, even without realizing that it's affecting or damaging the eyes?
True. In fact, that is the whole issue with glaucoma, and that's why we
Okay.
are calling it the silent thief, because the vision loss is happening from the periphery.
Okay.
And usually in day-to-day life, unless until we are into sports or we are doing a lot of driving, we often don't realize the peripheral vision is there.
Right.
By the time we realize, it's usually too late. It's reached our central vision, and from there we can't quite go back. In fact, there are so many times that patients come to us and say, doctor, it's only here now you've made me realize that I've lost some of my vision. I didn't know. For me, everything was normal.
Normal.
So it's quite surprising for them and sometimes shocking as well, I must say.
Okay. So, doctor, what exactly is glaucoma?
So glaucoma is a disease of the eye, which in Hindi we call kala motia.
Okay.
And it's a disease whereby the pressure inside the eye causes damage. So our eye is a closed structure, and any closed structure will have a pressure. Whether it's a balloon or a tire or any sort of a cyst or a cavity will have some pressure within it. Now this pressure for the eye typically should be about 20 to 21 millimeters of mercury. That's how
Okay.
we measure it. But in some cases, the pressure inside starts to increase.
Okay.
This may happen because of a disease of the eye, or sometimes a family history will cause that. And once this pressure increases, it presses on the nerve, which is at the back of the eye. Like if this is an eye model, at the back there is a nerve. So if the pressure inside is going up, it presses on this nerve,
Okay.
and that causes the nerve to get damaged.
Right.
Unfortunately, once the nerve gets damaged, it's very difficult to recover it back.
Okay.
And it's likewise with the brain as well. So since this nerve is actually an extension of the brain, direct damage to this nerve, also called as the optic nerve, leads to loss of vision.
Okay.
And that is what glaucoma is all about. And because this is a vision that is difficult to get back, it got the name kala motia, as
Right.
against safed motia, which is cataract, which you can easily treat by removing the cataract and putting a new lens.
Right.
But glaucoma requires a special form of treatment, and you have
Okay.
to catch it early.
So actually, the patient don't even realize that they are seeing in a normal vision, but back of the eye or inside the eye, there are a lot of things that are happening, which is causing them a vision impairment. Right?
Yes. In most cases, patients will not realize. Of course, most of the times this disease is happening to people who are above the age of 40, and many times they think that it is a cataract which is developing,
Right.
or something else in the eye, when actually it is glaucoma which is causing a damage.
Okay,
So it's very, very important for us to go and get our eyes checked.
that's really important. Yes. So, doctor, when you explain the term glaucoma to a patient, what is the biggest misconception that a patient has when you talk about the disease to them?
Oh, this is an interesting question. So, as I was saying, that glaucoma is also known as kala motia. So, a
Right.
lot of times patients will, confuse it with safed motia, which is cataract. and they think that, okay, once I get treated, whatever has happened will get okay.
Okay.
Just like in most eye diseases, you have a cataract, you remove it, you get your vision back. But in glaucoma, that does not happen. And for most people, they think, once they're on medications or they've had some procedure done, it is done and sorted.
Yeah.
But no, glaucoma is a lifelong disease. Just like diabetes, just like blood pressure, you have to take medicines lifelong. And I think that is that emphasis on people that, if you do not take this, you will get blind, you will lose your vision forever. Is the misconception. People think, I am seeing very well, there is no symptom. Why are you saying I got such a dangerous or such a this difficult disease to treat?
Right.
But I think ultimately, as doctors, we have to emphasize on them. And I think as glaucoma specialists, I get so many referrals from different doctors, even within the ophthalmic community, who would say that this patient seems to have lost this much vision. What do we do? He's still losing vision despite treatment. And we realize that there is an issue with compliance. The patient has not been explained very well. So it's very important that patients are explained the right pathogenesis and the right prognosis. This is a blinding disease, and there is no doubt about it if it is left untreated.
Okay. So, doctor, if someone is watching this podcast and if a patient has never had any eye examination before, so what is that one thing that they would take back from here?
I think, it's very, very important for us to have an annual eye examination. Because a lot of the diseases of the eye, just like glaucoma, can also be silent, whether it is related to diabetes, developing a retinal change, or it's glaucoma, or even cataract in the initial stages, or even sometimes just getting a little power in the eye. You may not realize if it's happening slowly. So an annual eye exam is must. But what tends to surprise a lot of people is that there is something known as eye pressure. Generally, we would not think about it. We know blood pressure, but eye pressure people don't know. And eye pressure is the cause for glaucoma. So that surprises people. Acha, eye pressure is also something. So, I think an annual eye examination is a very important thing. And particularly if you're above 40, there's no doubt you must do it.
So this is a take that all of us should take, that every time you should get a routine eye checkup done, and preventive eye care is also very important here. So doctor, with more than 15 years of your experience, why glaucoma has become a burden? Is it because the disease is getting recognized at a later stage, or because of lack of modern medicine over here?
Yeah, that's an interesting question. Glaucoma has become one of the most blinding diseases. In fact, it comes among, I think, the top 3 blinding diseases in India. And what I've seen generally over the last 15, 18 years is that a lot of times it's the late diagnosis. The awareness is not there. Even today, we're trying very hard. Year on year, we celebrate a World Glaucoma Week. We try to have awareness among the rural community, even among the urban community. People have become very aware of cataract, but awareness of glaucoma is still not there. And because of that, and because it's silent, people don't realize it till quite late. The other thing I think is that people are not compliant with treatment. If you have a pain or an ache somewhere, that pain keeps you wanting to take medicine for it. But if there is a painless disease, you probably don't even realize it and you will not take medicine. You feel, it's not creating any problem today. But over time, similarly, glaucoma over time can create a problem. You will end up with blindness. So, and then it's too late. So, because it's not shouting out to you, because people are not aware of it and people are not compliant with their treatment, is why it has become such a blinding disease. Also, a lot has happened on the front of treatment of cataract. So, there was a national program for control of blindness which has worked towards it, reducing the cataract burden in India. Even the burden of refractive error, which is the glasses, has been reduced by use of a lot of these outreach programs over time and school screening. But glaucoma is now becoming a thrust area for the government as well. So I think as clinicians, we need to reach out to people, through your podcast and through other means. It's important to generate awareness. Modern medicine has very good treatments. We can control glaucoma medically. We have surgical options. We have lasers. We have a lot that is available. Still, unfortunately, we have nothing to recover the vision once lost.
Okay. So it's the awareness that is lacking. So as we just heard, that preventive eye checkup is the most important thing, and creating awareness about the disease is also very important. So you can book consultation and eye checkup with us on One Health Assist, and please make sure that you are not ignoring this because this is a silent disease and they don't have any symptoms that you will know, feel in the normal life, but something is actually happening inside your eye. So please watch out for this. So, doctor, as you just mentioned, that annual eye checkup is very important when we are treating a disease of glaucoma. But what if the patients are not doing that? What they should be actually, what is the message for them?
Yes, I think so. I would say divide this into two parts.
Okay.
One is people who have a disease like glaucoma. If they are not doing an annual eye exam, in fact, in those cases, we are wanting eye tests every 3 to 6 months because
Okay.
the disease could be progressing, and as we said, there's nothing to reverse it.
Hmm.
So then they are going down a rabbit hole where they could end up with blindness going ahead, and the reason for that is because as we treat glaucoma with medicines or lasers or surgeries, but over time you have to keep titrating this treatment
Okay.
to keep the pressures in check. Just like for blood pressure, some medicine that is working for the first 2 years may not be working the third and the fourth year. You have to change it, and your body gets used to certain medicines and chemicals,
Right.
and you have to keep altering. Similarly, for a patient who's got glaucoma, we need to keep on modifying and changing. So it's very important to do regular checkups. And for people who don't have a disease, who are just going for a preventive eye checkup,
Okay.
once a year we definitely advise after the age of 40. And even before that, now the latest advice is for even for children is that after at the age of 4 years a child must have an eye checkup, a basic
Right.
eye checkup, because you cannot know if there's any change in power that is happening, whether there's any cataract developing in the elderly, whether there's any retinal changes, there is age related macular degeneration. So a lot of these changes have been associated with screen usage, with usage of blue light, and so somewhere or the other, there is some harm happening, but we are not being able to detect
Detect them.
And if you detect it early enough before it actually creates a vision issue, I think that ideally is our aim. So
Right.
annual eye checkups are important, and definitely if you're above 40, you must do that. If you're below 40, at least once in 2 years, if not every year, is what I would recommend.
Okay. So, doctor, when people hear the word risk factor, they usually think that it is for someone else. So, who actually should be paying a closer attention to this, and what they should be taking care of?
So risk factors, I think, are something that we always talk about in medical science, because
Right.
ultimately, we can't possibly screen the entire population for every disease. So we try to bucket them that, if you have this risk, you should do this checkup. If you got this risk, you should do this checkup. As you said rightly, so everybody thinks, oh, I'm not at risk of any disease.
Right.
I'm healthy and I'm seeing okay. But I think there are some specific risk factors, particularly with respect to glaucoma, that we
Okay.
must point out. So if you are above the age of 40,
Okay.
if you have a family history of glaucoma, somebody in the family who's lost vision or has glaucoma, if you have a high power, so even people with very high power in their eyes, if you've used steroid for anything, whether it was asthma or any skin issue or any body issue,
Right.
or whether you've had any injury in the eye or any other disease of the eye, all of these become risk factors for glaucoma. So those people must go and get themselves checked. Apart from this, people who've got diabetes, people who've got blood pressure, cardiac conditions, heart conditions, must also check for glaucoma, because they're also at an increased risk.
Yes.
Of course, anybody who's used eye drops of steroids for any other reason, or steroid use, let's say for their kidney problems or anything else, must also get themselves checked. Use of steroids causes the eye pressure to increase, and that
Okay.
in turn can cause glaucoma and
Glaucoma.
cataract.
So there are a lot of risk factors that actually needs to be taken care of when you are actually looking at the patients.
Absolutely. And even though I said people above the age of 40, we have seen glaucoma in the young. In my practice, I also do a lot of pediatric eye
Right.
checkups, and I am a pediatric ophthalmologist as well. And I've seen glaucoma in children at birth.
Okay.
So as young as 0 days of life, they have been born with glaucoma, and those, of course, are special situations, and we treat them differently. But it's a disease that is across the entire population, though the elderly are most at risk.
Okay. So, doctor, you just mentioned about the family history. So, even a healthy family member can develop a glaucoma genetically.
Yes. We've recognized a lot of genes now which are responsible for glaucoma. And in fact, if I look at my glaucoma patients, I think at least 1 in 4, if not 1 in 2, has some family history of glaucoma in their
Okay.
immediate relatives or in their next of kin. So as a fact, I feel that if there is a family history, then everybody in the family should get screened.
Okay. So, doctor, what can people do to actually reduce the risk of glaucoma?
So if you are, having one of the risk factors, whether you're somebody who's had to use steroids, or you're having to use steroids again and again, then you must do a regular checkup, because there are medicines that you can put in the eye that can reduce the eye pressure.
Right.
Whatever steroids are creating can be undone. Likewise, if you're a diabetic, if you got a cardiac condition or a high blood pressure, all those can be controlled.
Okay.
I think the only risk factor that we really can't control is family history, because you don't choose your family.
Yeah.
But other than that, most of the risk factors have some way that you can actually modulate them.
Okay.
And there are a lot of risk factors which, if you take care of them early on, glaucoma will not develop.
Okay. So it can be stopped also.
Yes.
So, doctor, if someone comes with a risk to you, how do you diagnose the glaucoma, or how do you give the treatment plan?
So in an eye checkup, we do a comprehensive eye checkup. So everything from vision to eye pressure to looking at the optic nerve, which is what is getting damaged.
Right.
So we do that through something known as a fundoscopy. We
Hmm.
take a photograph of the retina and the nerve, and we look for changes which are classically seen in glaucoma.
Okay.
We know that, as a definition, glaucoma is a progressive disease. So whatever we see today will get worse and worse and worse. So we see the patient over time as well. But prior to that, there are some tests such as the OCT or the visual field, which looks at the peripheral vision.
Right.
It tests for that. It looks at the nerve and sees how thick the nerve is, what changes have happened. All those are also used by us to diagnose glaucoma.
Okay.
So that's how we diagnose it. And once it is diagnosed, then we see that what form of glaucoma it is. There are some forms of glaucoma which are known as narrow angle glaucomas, where the normal amount of water is forming in the eye, but the outflow is less, so the pressure increases. In those cases, then we think in terms of certain medicines to reduce the inflow or increase the outflow, or we do a laser to create an opening so that the outflow opens up better.
Correct.
And then, or if it's open angle glaucoma where the outflow is good, but still there is some resistance to the flow, or where the inflow is more, in those cases medically we can treat through laser. And then in advanced cases, or where medicines and lasers are not doing the job, then we do MIG surgery, which are sort of minimally invasive glaucoma surgeries. We can put some stents to open the way of the fluid to go out and release the pressure, or we do a surgery known as a trabeculectomy or a valve surgery, where we place a valve. Again, when the pressure increases, water can flow out and the eye pressure can come down. So very simplistically speaking, this is how they work. Of course, these are advanced surgeries, and it has taken us years to be able to master them. And we're still, and still, I would say a lot of research is happening in the field of glaucoma. A lot of new things are coming. But as of right now, these are the options available.
Okay. So this is for our viewers. You can get in touch with Dr. Digvijay Singh on One Health Assist website, get your eyes checked and get treated. Let's start with the first one. I have grown up listening to the fact that don't sit very close to the television. So is that a myth?
No, there is actually a science behind it. When you do anything from nearby, it tends to increase the risk of myopia. So even today, our advice to children these days is that sit as far as you can from a screen. There is an optimum distance though. If you're too far from a small screen, that again will create a strain. But getting close to a screen means that you're doing more accommodation, your muscles are working harder, and the chances of your eye power increasing is more. Also, screens generally have little pixels in them, particularly the televisions of the older days, and even now, a lot of the LED LCDs will have plenty of pixels. And if you're watching that from too close, it's actually more strenuous on your eye.
Okay. So the next one is don't read in the dim light.
That again is actually good advice.
Okay.
It has been seen in studies now where they've looked at optimum lighting, that you have to have a good amount of lighting in the room, whether it is for reading or doing something else nearby in dim lights, is a risk factor for myopia. So you can actually have an increase in nearsightedness with that. So a well-lit room is important. Of course, the lighting should be indirect. You don't want light to be coming into your eyes as a glare. So a well-lit room, and definitely I think there is truth to this.
So next one being regarding the phone. Don't use the phone in dark room.
Yeah, I think there is some truth to this, in an extent that we have, our eyes have got pupils which become small in bright light and they'll become larger in dim light. So when your ambient lighting is dim or the room is dark, your pupils are larger. Now the pupils also create a defense mechanism for you to for bright light to not enter the eye, as well as they work in terms of focusing. So when you do a near activity, you want your pupils to be small, you want them, it helps to focus. It's called a near reflex.
Right.
So that gets negated to some extent when you're in a dark room. So
Okay.
your natural protection mechanisms are reduced, and the chances of injury or retinal injury from blue light or chances of eye fatigue and strain increase manyfold. So I think, yeah, there is some truth to that too.
Okay. The next one being carrots. They say that carrot खाओ आपकी आंख बहुत अच्छी रहेगी. Is that true?
Actually, we've been hearing this, right from the beginning. Now, carrot is not a superfood for the eye. So
Okay.
this is sort of a myth in that sense. But yes, carrots do provide us with carotenoids and carotenes, which are required for the
Right.
eye and the retina. Most of us are not deficient in these days.
Okay.
But it's not like if you eat lots of carrot, your eyesight will improve or anything. But you have to have a good diet, and that should include reds and yellows and greens.
Okay.
So definitely carrot comes in the reds. So carrots, beetroot, you can use tomatoes.
Right.
Lycopene comes in that. Then almonds are good, walnuts are good. In yellows, your pumpkin, papayas, mangoes. Then you want to use, gooseberries, good,
Right.
avocados, and of course your green leafy vegetables as always. So all of this, you have to use all these, eat all these colors for your eyes to remain healthy.
Okay.
But carrot on its own is overrated.
Okay. So the next one is parents usually tell their children not to rub their eyes. So how does that sound?
So rubbing of eyes actually can cause the corneal shape to change, the
Okay.
black part of our eye.
Mhm.
So that can become a little more oval in shape, and that can cause cylindrical powers to come in. Occasional rubbing here and there probably will not do any harm,
Okay.
but persistent rubbing for a long time with a lot of force can cause the risk of power to come in, or
Okay.
cylindrical power. And sometimes there are diseases of the cornea like
Mhm.
keratoconus which may form. So I think there is some truth to that too.
Okay.
And I myself advise almost all my patients not to rub their eyes.
Okay. So one of the biggest myths we have heard is that once you start wearing the glasses, your eyes become dependent on it. Does that make
Yes,
sense?
I think there
Yeah.
is some truth for that. If you have been prescribed some glasses or some powered glasses and you're not using it, that actually is more harmful, because
Okay.
ultimately you're straining your muscles, you're going to have headaches, you're going to have eye strain,
Hmm.
you're even sometimes you may develop squints, or
Okay.
you may start to have issues related to focus. But by wearing glasses, your
Okay.
muscles get relaxed, your eyes are more rested. And yes, of course, when you're rested, you get dependent on something that you like better, right? So if
Right.
it's more comfortable for your eyes, that's why they get dependent on them. So I think this is a good dependence to have.
So there is no harm in that.
There is no harm. We in fact tell our patients, you must wear your glasses all the time.
Okay. So doctor, we want to talk more about the screens. Are screens actually to be blamed for all the highlight they are getting in terms of the eye diseases?
It's interesting that you brought this up. So screens have been sort of our go-to reason for a lot of eye conditions, and
Right.
probably rightly so, because we've seen so many more eye problems of late, compared to what was noticed earlier, and
Hmm.
people's awareness is increased, and I think it's getting linked to screen usage.
Hmm.
To some extent, there is some merit in that, because excessive use of screens these days is causing a lot of eye strain, and this
Okay.
is related to the pixelated nature of the images on the screens. It is related to us blinking less when we are on the screens.
Right.
Typically we would blink about 14 to 16 times a minute, but when you're on the screen, you blink only about 4 to 6 times a minute.
Okay.
That reducing the blink rate alone is the cause of the problem.
Okay.
But yes, the screen is the triggering factor. So I think, to be fair, if it is a large screen that you're using, and you're using a screen from a certain distance or the optimum viewing distance, and you're using certain precautions like taking breaks every 20 minutes for 20 seconds, looking 20 feet away, blinking your eyes frequently, seeing the screen in a well lit room, not in the dark, seeing the screen in a good posture, then probably they'll not do all that much harm to your eyes.
Okay.
But certain conditions such as dry eyes or digital eye strain, or probably certain forms of macular degeneration, have been linked to screen usage
Screen
directly.
usage. Okay.
And I think so therefore screens have some harm to do, but
Okay.
they're not all that evil as we bring them up to be.
Okay. So डॉक्टर आजकल ऐसे होता है कि बच्चे जब खाना खाने बैठते हैं तो फ़ोन लेके बैठ जाते हैं, तो व्हाट इज़ योर रिकमेंडेशन कि स्क्रीन यूजेज का लिमिट क्या होना चाहिए? इवन adults after going back from work they also start using the phone or screen for a longer time, so is there a limit to that?
नहीं, आप ठीक बोल रहे हैं. Actually, screens have become indispensable,
Right.
as a form of entertainment, as a
Correct.
form of networking, connection these days. So, in terms of safe limits, we don't have definitely defined safe limits for
Okay.
adults, and for children also. The right answer would be as less as possible.
Okay.
But if I was to sort of quantify, I think it is more the way you're utilizing the screen that is
Okay.
important. Wherever possible, use a bigger screen. Wherever possible, use it at a distance. Wherever possible, use it for 20-30 minutes.
Take
Take
a
a
break.
break, look away from the screen, and for children particularly, I would say that phones are sort of a terrible thing from two perspectives. One, for their eyes, which is, of course, it is creating eye strain. You're doing a near activity, your risk of increasing myopia is a lot more. Children are developing digital eye fatigue and strain
Correct.
these days, headaches. But also the other aspect is that from a mental development and concentration standpoint, there's a lot of digital autism now. So
Right.
children are getting confined into
Confined,
themselves.
yeah.
They don't want to interact with other children. Usage of screen, they're developing attention deficit,
Right.
and they are constantly scrolling. And all this, I think, is leading to a very different sort of generation that is coming up.
Correct, yeah.
So we have to be very careful with our screen. I think as parents, my advice to our viewers, or as teachers anywhere, would be that try to limit the amount of screen usage that your child is having, whether it is for education, whether it is for entertainment. Make them see the real world more. And wherever it is required, and I know for a fact that screen has a lot of plus points, because you
Right.
can explain a lot of concepts, you can do a lot of networking and connections, but use it for 15-20 minutes. You must have a scheduled use, and it should be within that time that the child is allowed to use it.
Right.
It must not be a free use all the
All
time
the time,
situation.
yeah.
We can do that for the bachas, but for the adults it's very
It's
difficult. So
difficult.
you have to self-regulate. Adults can regulate the children, but self-regulating is important, because even for our eyes at this stage, the eyes are getting older, and there is a lot of exposure to screens. So even we are getting more limited to our group of social friends on the screen. We are getting limited to uh, spending most of our time there and not even interacting with our family. So beyond the eyes, I think that part is very, very important. And the safe usage methods I've told you, the 20-20-20 rule: blink your eyes frequently, take breaks from the screen, a well lit room, and a larger screen at a distance.
Correct. That was a great advice that we received from the doctor. So please follow this advice to keep your eyes healthy. So, doctor, what are the secret lifestyle habits that does not receive that much of importance, but they are important to maintain a good eye health?
Yes, I think there are in our lifestyle there are a lot of things that people do that indirectly help their eyes
Okay.
or even harm their eyes.
Okay.
And a lot of them are open secrets, because we don't really think of them as things that we're doing in our daily lives. Lifestyles changes that one should make, or lifestyle habits rather, I would say, that can cause an improvement or are healthy for your eyes,
Okay.
is spending time outdoors. So we say as a child you must spend 2 hours outdoors, as an
Right.
adult you must spend 1 or 2 hours outdoors every day. Look far, so stargazing, gazing at the sky, gazing far, walking around in open green grass is very, very good. In drink lots of water.
Okay.
Eyes have tear films on them, and they
Right.
require water. So if you're dehydrated, your eyes will become
Right.
dry, and that will cause an eye fatigue. So drink lots of water. Give your eyes rest. Your
Okay.
eyes deserve it. They are working from when you wake up till you sleep.
Sleep.
And very often just before sleep we're using our phones and
Right.
things. So the eyes don't get the proper rest. So rest your eyes. Even in the day, whenever you get a chance, give them a break. I'll teach you a very simple exercise of palming, where you can simply rub your hands together for about 10 seconds, and then for 30 seconds just
Close
keep
them.
them over your eyes with
Okay.
the fingers crossed. Just let the heat seep in. That sort of relaxation helps.
Okay.
People do a lot of eye exercises, which is also good, but whether they are directly going to make much change, one doesn't know. But it does help tone the muscles of the eye.
Okay.
And on the flip side, things that cause more damage to the eye, are things like sun gazing. A lot of
Okay.
people are into that habit during the day. Not using your eye glassware properly.
Hmm.
Glass spectacles which are scratched, or spectacles where the coating has come off.
Okay.
Overuse of screens, use of screens at full brightness, that
Okay.
in itself is a problem, or quite the contrary, even on the lowest brightness, because
Hmm.
both of that causes a strain.
Strain on the
And
eyes.
not taking a proper diet, I think this is all that harms the eye. But the secret to good eye health are these little changes that you'll do in your lifestyle.
Okay. That was a great piece of advice that we received from the doctor on secret about how to maintain good health on our eyes. So you can get in touch with the wellness experts on One Health Assist website to get a better lifestyle in terms of diet, wellness, or yoga itself. So in today's day, what can an eye examination tell about one's body in a general health manner?
So the eye is the window to the body, they say.
Okay.
So an eye examination can tell us a lot about the body. People with dry eyes may be dehydrated. If the eye color is yellow, there's risk of jaundice or liver disease. If you've got, the cornea, the black part of the eye, rings around the black part can tell you about high cholesterol.
Okay.
Changes in the retina can tell you whether a patient is diabetic
Diabetes.
or having blood pressure. Even now, there are ways to tell, looking at the eye, whether the patient is at a higher risk of stroke or not. So a lot of this is where the eye comes into the picture.
Okay.
And even when in pregnant women, we're able to judge whether there is any changes happening to the fetus
Features.
based on how the pregnant woman's eye is. So the eye truly is, opening your eyes into the body's health.
Right. So let's move to the next segment about eyewear. So, doctor, when I was coming for this podcast, there are a lot of my friends who wanted me to ask this question to you about the spectacles. So, what kind of spectacles they should go about, or what are the types?
Yes, I think a lot of different varieties of spectacles are now
Yes,
available, and generally, you can choose one that sort of fits your face and your
correct.
your body style and your general style language. But from an ophthalmology or a medical standpoint, we typically want glasses to cover the full eyes.
Okay,
And there could be different types of glasses. There are monofocal glasses which give you good vision for distance, or you could have only reading glasses.
correct.
Or then there are bifocal, which used to have the distance, which have the
Yeah.
distance and a little bit of the near as a moon-shaped
Hmm.
lens in between.
Right.
But the modern glasses these days are also progressive,
Progressive.
where they don't have that line which is separating the distance and the near, but it's a continuous change between the distance and the near.
Right.
So these progressive lenses is what we see now in the elderly, and they're using that quite a bit. But from a lens standpoint itself, I think you should have an anti-glare coating
Okay.
because if you're using screen, that helps. Blue cut lenses are there these days that remove some of the blue light,
Yeah.
but they are a little overrated. I think we don't yet have entire scientific evidence on them, but we know that blue light can affect sleep. It can cause
Right.
sleep disturbances.
Hmm.
So possibly there's maybe some merit in getting that. But most of all, I think the glasses should not be scratched and have to
Okay.
be cleaned properly.
Right.
If they are smudged or scratched and not very clean, that can cause more eye strain for your eyes.
Okay. So let's try and understand next question about the contact lenses. There are so many varieties of contact lenses that are available. So are they actually safe to be used, or is there any limitation that we have to, stop wearing the contact lenses after a particular duration of time?
Contact lenses are a good alternative to glasses.
Okay.
It is something that I recommend children above the age of 15 can also start using
Okay.
socially if they need to. But typically, I prefer it's for the adults because contact lenses directly touching your eye.
Right.
And contact lenses usually are either soft, which is what most of us use, and sometimes we have special situations where we use hard contact lenses. The soft contact lenses could be daily disposable, which
Right.
every day you use one and throw, or
Okay.
monthly disposable, where one pair works for the full month.
Month.
Though monthly disposables have slightly better material,
Okay.
but need to be properly cleaned and kept and
In a
used in a
solution,
certain
yeah.
manner. Contact lenses, I feel, are best used socially or for limited periods, 8 to
Okay.
10 hours, even though materials these days are allowing extended wear up to 10, 12 hours also. Because beyond that, there is risk of dryness in the
Right.
eyes, there is risk of increasing infection in the eyes on the cornea. So all this, is important when you're using contact lenses. Proper training, and I would advise you must go to an optician or an optometrist or an ophthalmologist if you're the first time using the contact lenses. There are colored contact lenses that
Right.
people
I was
use for
about to
their
ask next. Yeah.
yes, that people use for their looks. You could use it, but please for a short duration and don't make it a habit.
Okay. Not safe for a longer duration.
It's probably not the best for the
Okay.
eyes.
So there are a lot of people who don't want to use spectacles, or they don't want to go for contact lenses. So what are the options available for them?
So refractive surgery is what we have now, where you want to get rid of the glasses or
Right.
the contact lenses. This is of either you can use lasers to actually
Okay.
burn the cornea in a certain way so that you don't require the power anymore, or in higher powers or situations where the cornea is not safe for a LASIK.
Hmm.
That's where we do a procedure called the ICL, where we put a lens inside the
Inside
eye,
the eye.
similar to a contact lens outside
Correct.
the eye.
Correct.
So these are the two options. But within LASIK nowadays, we have a huge variety of these keratorefractive procedures, which are from LASIK to Smile to Contura to Silk
Yeah.
and all sorts of
Lots
lasers.
of.
So I think the best advice would be based on your particular power, that your friend should go to an ophthalmologist, get
And
checked
get
up,
checked.
and they can guide them better.
Right. So, doctor, you are a pediatric ophthalmologist, and I see a lot of children wearing glasses nowadays. So, when can they actually get rid of glasses if they want to? Is there a particular age limitation there?
Yes, I think we are seeing a lot of myopia in children, which is nearsightedness of late,
Hmm.
and in the government and the world has taken note of it. In fact, it's assumed that 50% of the children will be myopic within the
Okay.
next decade and a half, and based on that, a lot of work is happening in this field. But LASIK is still not for children. It
Okay.
should not be done before the age of 18 under any circumstance, except if your ophthalmologist advises in a very special situation. 18 continues to be our cutoff for LASIK surgery.
Okay.
But there are things that we can do to help the child control their power earlier.
Okay.
So it is from advising, parents on the right lifestyle measures, whether that is with regard to child spending more time outdoors,
Hmm.
less than 45 minutes of reading at a stretch, less than, not reading less than 20 centimeters
Okay.
close, less of screen, good diet. So all this is what we advise to parents. But along with that, these days they have certain eye drops that help control the eye power from
Hmm.
increasing, and special glasses called myopia control glasses
Okay.
that I routinely prescribe to help these children not have their power increasing over
Increasing.
time. Even to do a LASIK, for example, we require the power to be within a certain range
Okay.
based on that child's cornea. So typically, if it's within the range of 6, 7, it's easier for us to uh,
Get a
get it
LASIK done.
LASIK done.
Okay.
But myopia control these days is very, very important. And I think as parents, as clinicians, as teachers, we have a responsibility to try and make our child's eyes as healthy as possible.
Okay. Since we are talking about the modern lifestyle, doctor, how does AI impact in terms of the ophthalmological testing? Or I have even heard that you are into AI in terms of the treatment. So, can you throw us some light on that?
Yes, I've been doing a lot of work in AI in ophthalmology, and I
Okay.
think AI is helping us ophthalmologists in terms of diagnosing early, whether it is for glaucoma, whether it is
Okay.
for cataract. There are AI softwares that are helping. A lot of them are still in the research stage and are coming out, but the ones that we are using now in my practice, we're using is for diabetic retinopathy, for glaucoma, and AI has also become a part of the LASIK surgeries,
Correct.
where they are able to adjust the machine in a way that it burns the eye cornea perfectly to achieve a perfect result.
Okay.
So AI, I think, is coming in ophthalmology also in a big way, and I've been doing a lot of work on it, a lot of research on it,
Okay.
and I let's see, the next 5, 10 years should see a big difference.
Great. Let's move to the next segment, sir, and understand or know from you. Was there a specific case that was, heart touching for you or made a life changing, thing for a patient?
Oh, that's interesting. Actually, as doctors, we tend to get a lot of patients where they feel their life has changed after we've
Okay.
been able to do some treatment for them, which I think is one of the, we're honored or privileged to get that opportunity.
Absolutely.
But I think if I was to share one, this is probably to do with a child who we had treated, at a very early age, just within the first 2 to 3 months of age, for
Okay.
a cataract and a glaucoma that the child had, and the child had to undergo 2 or 3 surgeries overall. And it was only, I think, by the age of about 1 year that the child, for the first time, saw his mother
Mother.
and
Okay.
realized that this voice that has been with me, or somebody who's been feeding me, or the touch that I felt, it actually looks like this.
Wow.
And I think that smile, that social smile that came on the child, that was amazing to see.
Okay.
And I think the parents even today are very grateful to Almighty for having got their child some vision, and we tried our best. So there are this and lot more stories. There are situations where we've operated people for squint,
Okay.
who were feeling socially very inward, and suddenly became very confident leaders. And I know, one such patient of mine who was almost, into severe depression because of that, and today is actually leading a company in the
Nice.
country. So these are the situations where I feel, you feel very good that you've been able to help them out.
That's actually really very nice of you to share these stories with us and with the viewers so that we understand what are the happiness on the patient's face when they are treated with any of the eye conditions. So that was really nice of you, sir. So, doctor, if you could redesign eye care in India over the next decade, what could be that one thing that you would like to change so that people are getting prevented from losing their eye?
That's a tough one.
Ah,
I I think probably what I would say is that if we can use the very tool that we are blaming for eye problems, which is the smartphone,
okay.
to become a way to screen your eyes,
Okay.
whether it is for vision or maybe for glaucoma or the retina pictures. And I think there's some work that is happening.
Okay.
Once that comes into place, then everybody holds in their hand a tool to screen their own eye. I think that will make a big difference to preventive eye care.
Okay.
And ultimately, prevention is better than cure.
Absolutely. So that is the greatest advice that we have heard from you. So this brings us to the closing of our segment. So, doctor, how do platform like One Health Assist help you in your daily routine?
I think One Health Assist uses technology to
Right.
be able to connect the doctors with the patients and as well as provide awareness, what we talked about. So I think it's doing very well as a platform.
Okay.
And I hope to be able to interact with all our viewers through this platform going ahead too.
Okay. So this brings us to the end of the podcast. Please like, share, and subscribe and stay tuned.